17 Early signs of pregnancy. 1. Implantation, bleeding and cramping. If you had unprotected sex around the ovulation time, i.e., your fertile window, there is a possibility of you getting pregnant. You will experience menstrual cramps, light spotting or bleeding before a week or two of your missed period. Not everyone experiences the same symptoms, but if they occur, they could be the very early signs of pregnancy. Implantation takes place when the fertilized egg attaches to the lining of the uterus. It occurs around 6 to 10 days after ovulation. If your cycle is regular, i.e., 28-day cycle, you will experience implantation, bleeding and cramping in the third week, i.e., around days 20 to 24, a week or so before the missed period. 2. Elevated basal body temperature. One of the earliest signs of pregnancy, basal body temperature, BBT, is more accurate than the others. But you can figure out the change only if you track BBT for several months. A couple of weeks before ovulation, your basal body temperature may be around 97.2 to 97.7 degrees Fahrenheit. It is the average BBT in the pre-ovulation state. 2. 1 to 2 days after ovulation, your BBT will increase from 0.4 to 1 degree. It decreases after you complete your period. But in pregnancy, the BBT remains elevated. The BBT changes are subtle and you will be able to observe a change in them after you track it every day for a few months. 3. Sore, tender, and heavy breasts. Breast changes are also early signs of pregnancy. The moment you conceive, hormones send signals to the breasts to get ready in 40 weeks. Initially, the blood vessels present in the breasts dilate and start growing. Your breasts will thus become larger and the areolas, the dark-colored circles on the nipples, also become bigger and darker. You can notice the breast changes in a week or two after conceiving. You may feel them tingly, swollen, and sore to touch. You will also feel uncomfortable and cumbersome. These signs may be similar to those of PMS, but they are worse during pregnancy. If your period is late and you observe the breast changes along with other symptoms, you should take a pregnancy test. 4. Fatigue. Fatigue without a reason may also be an early symptom of pregnancy. A spike in the levels of progesterone hormone can make you tired and sleepy all the time. Additionally, as the body begins to produce more blood to support your fetus growth, you will feel exhausted, especially if you don't get enough minerals, vitamins, iron, and fluids in your diet. If you are pregnant, you should begin taking prenatal vitamins every day. Do not take caffeine and associated products. Sleep well to fight fatigue. As fatigue can also be due to health issues like anemia, hypothyroidism, etc., you cannot assume that you are pregnant by the symptom alone. 5. Nausea. Nausea or morning sickness is a classic sign of pregnancy that you can notice in the early stages. It will afflict you in the initial weeks of missed period even before your pregnancy is confirmed. You will feel dizzy, weak, and may want to throw up at times. Though you may feel nauseous at any time of the day, the early mornings would be the worst. About 75% of women experience morning sickness, but the severity may vary from one woman to another, and with each pregnancy. The condition may be worse in your first pregnancy, but may subside with the eventual ones. The hormone HCG, human chorionic gonadotrophin, elevates in the early stages, causing nausea. Nausea usually subsides after your first trimester, but sometimes it may last through the 9 months. In some women, morning sickness will not set in until the 6th week, whereas in others, it starts early. 6. Bloating and feeling of tightness. Your tummy may protrude, your pants may be tight, and you might need to unbutton to breathe easily. You may look like pregnant even if your fetus is tiny, or just a ball of cells, blastocyst. A heavy or bloated feeling in the stomach is the most uncomfortable and a common symptom of pregnancy before missed periods. Bloating could be followed by farts and burps because of the progesterone hormone, which retards your digestion. To get relief from bloating, Eat small portions through the day for easy digestion. Avoid fried and fatty foods, and choose healthy foods. 7. Urge to pee. Having the urge to pee is a normal pregnancy symptom that you may get as soon as you have missed your period. You may frequently have the urge to pee, especially during the night. After you conceive, many hormonal changes occur and there is an extra production of blood, which causes frequent urination during pregnancy. The kidneys work to filter more blood, filling up the bladder, causing you to pee frequently. 8. Food aversions. You may not feel like having your favorite foods, and their smell or taste might make you nauseous. About 85% of pregnant women experience food aversions during their first trimester. Most of them come back to their normal appetite by their second or third trimesters, but for some, food aversions may last through the entire pregnancy. There is no solid evidence on why the aversion occurs due to the smell, but it is believed that it could be due to the elevated levels of progesterone. 9. Dizziness. Dizziness and lightheadedness are also early symptoms of pregnancy, caused by low blood pressure. In your first trimester, it is normal to experience dizziness as the blood vessels dilate, reducing the blood pressure. The blood pressure gets back to normal during the second trimester. Being dizzy without any other symptoms is normal, but if it is accompanied with vaginal bleeding and abdominal pain, it can be a sign of ectopic pregnancy, which is a serious complication. 10. Mood swings. Mood swings are also due to hormonal changes. The variations in the hormone levels affect neurotransmitters of the brain, which cause enhanced emotions, from spells of weeping to sudden anger outbursts. Trying to relax, getting some rest, or talking to someone or your partner, would help people around you understand your situation. 11. Constipation. Hormonal changes, especially the elevated progesterone levels, can affect your digestive system. Your bowel movements get harder as the hormones cause the food to pass slowly along the digestive system. If you feel constipated regularly, you should consider taking a home pregnancy test. 12. Headaches and backaches. Low blood sugar levels cause headaches as the brain cells try to cope up with the lower levels of sugar supply. If you have frequent headaches, then it could mean that female sex hormones like estrogen and progesterone are working to prepare the womb for the baby. You could also experience lower back pain as your ligaments loosen up while your body prepares to carry the weight of the baby. Implantation, cramping, bloating, and constipation can all cause backaches during early pregnancy. You can ask your doctor for some medicines, but never try self-medication during pregnancy. Also, it is important to understand and pay attention to your sleeping positions at night. 13. Drooling. It is not a common symptom but affects some women in their early pregnancy. Some women may produce excessive saliva before they conceive. This condition during pregnancy is known as tylism gravidarum. The excess saliva production is related to heartburn and morning sickness. Women suffering from nausea do not feel like swallowing, thus building up extra liquid in the mouth. Also, if you are suffering from heartburn, you may have excess acids and hence the production of saliva increases to fight the heartburn. Saliva is usually alkaline in nature and helps to neutralize the acids in your body. 14. Metallic taste in the mouth. You may experience a metallic taste in your mouth along with a strong aversion to a few odors. Some women may have a lingering metallic taste all day long. Though the actual cause is unknown, a few experts say that it might be due to fluctuating hormonal levels. Some women may suffer from this all through the pregnancy, while for some it disappears soon after the first trimester. 15. Excessive thirst. Early stages of pregnancy make women feel thirsty, often due to the increase in the blood volume. It, therefore, causes frequent urination that in turn will make you feel thirsty again. 16. Lack of appetite. Due to nausea and vomiting, your appetite will be at its lowest ebb. You will have hunger pangs and strong cravings for foods like pickles. However, your appetite is on the downward slope, and may improve in the later stages of pregnancy. You can smell lavender essential oil since this helps in curbing nausea. You can also have lavender shortbread biscuits to reduce nausea and increase your appetite. Reducing stress improves appetite to a great extent. 17. Shortness of breath. You may begin having shortness of breath in the first few weeks of pregnancy since your body requires more oxygen and blood to share with the growing fetus. It continues throughout pregnancy as the baby grows and the need for oxygen and nutrients. Having an exercise routine, sitting in a proper posture, taking slow deep breaths, wearing loose clothes, etc., should help in regulating your breath. Certain symptoms of pregnancy may be due to other medical conditions. The symptoms that are discussed above may not always conclude that you are pregnant. They are only the indicators of your pregnancy. Your pregnancy can be confirmed only when you miss periods, and the test kit shows a positive result.